Cancers around the world, the top 5 cancers in South Africa, colon and rectal cancer in both males and females. So it's something that's very common. I mean, worldwide, there's nearly 700,000 new cases of colorectal cancers diagnosed annually. In our province of KwaZulu-Natal, if you look at Durban alone, in State Hospital at Alba Lutuli, they see nearly 150 to 200 colorectal cancers a year at Alba Lutuli. So it's something that's fairly common and shouldn't be overlooked.
You think it's a better diagnosis, or are more patients presenting with colorectal cancer and other challenges?
That's very interesting. Access to healthcare has certainly improved over the past couple of years. So patients are getting into the system, getting worked up and being diagnosed. And the other issue is that, is there really a shift towards younger patients with colon and rectal cancer? And that's currently being looked at, whether diet, environment, genetics are now playing a role in younger patients presenting with colon cancer, and some of them are specific race groups. So it's important that we look at this and not just all call it better access to healthcare.
Dr. Moola, persistent diarrhea, constipation, abdominal pain, rectal bleeding, unexplained weight loss, are these signs that we should be more aware of? These should be sending off alarm bells to say, go and check yourself out?
Well, that's correct. There's certain alarm or red flags that are for lower GI, for the colon and rectum, some for the upper GI tract, the stomach and the esophagus. But commonly with colon and rectal issues, rectal bleeding is an alarm sign. Unexplained loss of weight, a change in bowel habits that persists often for more than 4 weeks.
When you say change in bowel habits, what should people be looking at?
So it could be, so most patients know their own bowel. They know what their cycle is like, and when they're meant to pass stool, they know once a day, once every 2 days, twice a day. So that's very individualized. But any change that may be something new that persists, either new onset diarrhea that goes on for weeks, or new onset constipation that now, look, I'm not as regular as I used to be, something is going on, one has to start worrying about maybe there's something going on in the colon. Change in the caliber of the stool. Previously formed stools are now narrow and pencil-like. Pain, we mentioned rectal bleeding. We've also an abdominal mass. If they feel a lump in the abdomen, that's another warning sign that something could be going wrong. So there are several red flags or alarm signs, and these need to be just raised that maybe something is going wrong.